Why did you decide to write this book?
I had to write that because I feel like as I learned more about AI and to put the pieces together, with Epic and Cerner and Compass Rose and all that, a lot of this, and going to some of the conventions and stuff. I go to a lot of the AI and healthcare conventions. The voice for nurses also, because there's no nurses out there. I think I'm sometimes the only one. We need to get to
Oh,
the table when these decisions are being made. Yeah, and join in the conversation.
yes.
I decided to write that book because I was talking to a lot of my colleagues about AI, and I told them, I think this is something that we need to be more involved in as nurses because a lot of decisions being made about AI and they're implementing it every day into healthcare. And a lot of nurses don't even know. They don't know what's in there. They don't know what's embedded in the system. They're scared of it. And it's like, it's not really for us to be scared of. Just a tool.
Greetings, greetings, and welcome to When the Moment Chooses You. I am your host, Coach Charlene, and I am extremely delighted today to have Miss Nina Stevenson with us. Welcome to the show.
Thank you. Thank you so much for having me.
Yeah, I'm really excited to have you. I actually have her book here, one of her books, it sounds like. But before we get into the conversation, I want to just set a little bit of context of why I created When the Moment Chooses You. It really came out of 2020. We had I'm calling it the triple pandemic. We had COVID 19, we had the racial injustice. We had our own personal pandemics of loss and, isolation and things like that. So during that time, I actually took it to prayer because it was so traumatizing to see what happened to George Floyd. And so when I was in prayer, I heard these words: what you do in this moment will determine your destiny and dictate your future. And so I knew that that was a commissioning for me to move from anger and frustration to action and impact. And so I started sharing my story, and that like literally went viral. Like I found my voice, and then it began to start impacting those around me and start doing things to help with the challenges that we were facing. And so that's kind of why I started the podcast, to really capture people's story, those stories that people kind of did something different. You disrupted your system, you disrupted yourself, or you transformed, as you navigate through your journey. I happen to be a nurse leader, so of course I have a lot of nurses on, and but I've had more than nurses on too. So Nina, that's kind of where we're going today. So we're going to unpack who you are, and so if you don't mind telling the audience a little bit about who you are, that would be great start.
Right. I'm just a little chubby chick from Chicago, but Chicago, Illinois. I moved to California when I was 18. Just my mom asked me what I wanted for my graduation. I was the one out of eight that graduated. I said, I just want to go to California to see my sister, my oldest sister, because she had moved here a couple years prior. And that's how I ended up in California. And so I've been here for 7 years. My mom actually went to a store maybe like 3 or 4 months of us being here to buy a new sofa, and she met my husband, and my husband put this sofa on the couch, and then that's how I met my husband.
Wow.
Yeah, it's crazy. So he came in. My mom came in the house. She said, "I met this nice guy, Nina. You need to just marry him. He's amazing." And it's just so
She's
funny how it
sweet.
worked out, and I married him.
Oh my gosh, that's amazing. What a great story. So tell me about your nursing journey. How did that start?
That leads to my nursing journey. When I moved here, all I wanted to do was go to school and be a nurse. And I met my husband, and we had all these children. We had 6 kids later, and I just kept wanting to go to school. So I ended up going back. But I started out as a certified nurse assistant. I went and did something called Method 3, where I challenged the California LVN board, and I passed, and I got my LVN license. And then I went and did a bridge program. And so that's how I ended up but I've been doing nursing forever, but that's how I got my RN license. So I've been working in healthcare since I was 18. I was one of those candy stripers and CNA.
Yeah,
I
yeah.
did ICU tech, cardiac monitor tech. I worked as a chiropractic assistant, done a little bit of everything in healthcare. And I was like, let me just go back and get this RN and get it done.
Yeah, that's awesome. Wow, that's a really great journey. I did that as well. I was in the military, so I was a medic in the military. And then when I got out, I was a CNA, but then I challenged the board and got my LVN. And, just kind of went through the same journey. So we're like twins in that regard. So that's super cool. But that for me, the only way I was able to go to school was through the army because we didn't have money. And so I needed some type of money. So I saw 25,000 as Army College Fund, and that like lured me in, and so I joined the Army. But it was one of the best moves in my life. And so why don't you tell us, Nina, tell me a little bit about a moment that chose you to do, because it sounds like you're doing quite a bit, and you haven't even told us everything. Because I met Nina came to my book signing, and it was such a pleasure to meet her when she came. And she also has this book about smart nursing, how AI is shaping the future of healthcare. So I just found you very fascinating. And when I started digging into the book, I was like, this is like so cutting edge. I love it. And so I had to have you on the podcast. So before we get into that, you also have a school, right? Tell me a little bit about that program.
Yeah, so I guess I'll go back to where you said about the moment because that'll lead into the school. So my
Okay.
moment when I feel like, chose me to spread my wings and navigate is also during COVID. I got a similar story to yours. It's funny. But during
Hmm.
COVID, my sister to COVID, and it actually happened. She passed away in my hospital, and it was just all so fast. She came in the ER, I didn't even know she was there. Found out she was there in ICU. I had spoken to the nurse, and they were like, "Oh, she's doing great. She's on room air, but because she's had COVID, couldn't have any visitors." So I was like, okay. And maybe like 15 minutes after I just talked to the nurse, they called a code blue. And I'm like, oh, Lord, I hope that's not my sister. And it was her. But then, like 2 or 3 minutes from that, they came and got me and, brought me down, and she had passed. And it was just blood everywhere.
Oh
So it
my
was very
God.
traumatic. And ended up cleaning her up and all that stuff. But I think at that moment, I didn't know that life was going to change, but it did. So I went to, bereavement leave, took leave, tried to come back to work, and I just couldn't do it. Every time I hear medical code, I would just break down. So I said, I'm done with nursing. I'm going to go do something else. So I took a break and I stayed home for a little bit with the kids. And everybody said, Nina, you got to get back to nursing. You love it. We love you. Everybody, the patients miss you. And so I
Yeah.
started back doing contract. So that's when I got into traveling. And I love that. I love traveling around. But I did notice that I still love nursing. I noticed that I still love to mentor and teach people and inspire people to go into nursing like CNAs and challenge the board. So I decided, okay, well, what am I going to do? What is the purpose of, this lesson, God, so I brought it to God and prayed on it. And I decided to help, which I was already doing, but just do a little bit more. I was already motivating people and inspiring even nurses to go back to school to get their master's and their nurse practitioner, especially if I saw something special in them. Decided that I wanted to take people in the healthcare field like me that maybe had the experience, but they didn't have the money, right, to go to school. They couldn't afford it. Or maybe they have dropped out of nursing school for many different reasons. Because I had a lot of friends that went to nursing school and they dropped out. They were pregnant or got divorced, all kind of things. But this lesson, I feel like it came from my sister passing because it just bothered me. And I'm like, why did this happen? Like, what could we have done different as nurses, as a healthcare system as a whole? And the only thing that made sense to me was definitely to have more staff because the one thing the nurse said is that she felt like she missed something because she was so busy. It was COVID, everybody was sick, we didn't have enough staff. So I was like, well, how can I create more nurses so we can have more staff? And then I felt like something in technology could have prevented this death too, which I feel like we had enough stuff, but I guess it's just never enough. So that's what me to technology and then also to my school. So in my school, I help people with healthcare backgrounds to the board to get that LVN license, and then I motivate and coach them on to get their RN license. At the same time, I'm teaching them about technology. I have a certified AI nurse consultant program, and I embed that into the program. So when they come to me, they learn how to they learn AI. They learn AI how we implement it in healthcare, about different programs, software. They learn about a lot of AI tools. We actually help them start a business. They actually write a book, and that's how I met you because we have field trips usually once a month, and we go out to meet different authors. So I do some research about the different authors and book signing, and we chose you that month. So I brought some of the students
Yay.
to come see you. Yeah, usually try to motivate them and inspire them about their story, and motivate them to things to write about.
Well, that is like phenomenal. I mean, really phenomenal for your heart to give back to the profession. I mean, that's so good because I think about like as a nursing assistant and, as an LVN, like to have someone to help you to go through the process to become a nurse is like phenomenal because I didn't necessarily have that. I just kind of was fumbling along trying to figure out what I was doing, but to actually have that support and that mentorship and then you actually are bringing in like the cutting edge AI and all the other things is amazing. So that is so wonderful. How long have you actually been doing that?
Helping people do the Met 3 process for about 10 years, but my school, I've been open about 16 months now.
Wow, that's great. Congratulations.
Thank you.
What's the best thing about it that you love, your school in
To see
particular?
people life change. I get goosebumps just talking about it. I love to see the girls. This is almost free. I have a nonprofit that I take donations from, and I fund most of it myself. Yeah, they
Wow.
pretty much go for free. I give them books, supplies, and everything that they need to complete this process. But I love when the girls come to me and they have the experience, but they don't have something like a high school diploma, or they may have something on their record, and we help them get that off. So I love to see that transition happen when they come in thinking that they can't do it because they just never had the motivation or inspiration, or just felt like they just couldn't do it to even get the high school diploma, and then let alone get an LVN license. Like, it's amazing. So they see me in the community, they're like, that's just a good feeling just
Yeah,
to
I
see their
bet.
life change, to go from, not having a car to
Yeah,
now they have
that
a car and an apartment, and now they're talking about buying a home. So I just love that part of it. That's the biggest inspiration. Yeah. A motivation
well, and
that I have.
that's like so beyond. Yeah, it's so beyond like just giving them knowledge. You're actually helping them with life lessons and
Lessons, yeah.
skills to
Treat
I
the
mean,
whole
it's
nurse, not treat the
powerful.
whole student.
Yes. Speaking of that, we know that at least 65% of nurses are burnt out according to the research, right? So, do you embed any of that type of stuff in your curricula for them?
I just created a burnout nurse course from Sutter Health, because they have a new grad program, and they actually adding that to their new grad program. So yes, I have a community too, where every so often we get together, and I realized quickly the location I had on Hurley was too small. So we just got a bigger location in Natomas. So I'm hoping to do at least once a month, where I can bring nurses in as like groups, and we can talk and go through because that's what it is like a lot of nurses just need to be around people that's going through similar things, and they need to talk it
Yeah.
through, and just help them get through navigate those steps. Because I work at UC Davis also. It's a lot of that going on right now. So I find myself being the mama bear most of the time when I'm at work, is motivating the nurses to keep going, and take breaks if they need to, take a day off. We do a lot of, when I'm there, we do a lot of dancing and yoga and just fun activities to kind of break up the shift a little bit. And maybe we need more of that, on the floors and stuff.
Yeah.
Maybe that would be more helpful for people, because I don't know, when I'm there, they just break down. Everybody's telling me everything. I'm like, oh my God.
Yeah.
Need I
That's so
need more
funny you
mama bears
said that.
too.
Yeah, that's funny you said that because and I think that comes from your heart of servant. You have like a heart of a servant. And so people want to pour all of their problems on you. So I experienced that too, and I think that's what really made me consider early retirement. So I've been retired now for for a year, and to be able to go back in and the support the teams and the nurses and the physicians and the nursing assistants and all of that is like super amazing. Like I just didn't see myself, Nina, just being done because I knew that I had so much more in me to give. And so to be able to actually teach tools and things to help people navigate through chaotic system is like so life-giving for me right now. So I really love what you're doing. I love to hear the inspiration and motivation in your voice as well. Now, let me ask you a question. As a nurse, let's talk about barriers because a lot of times people get stuck because of those barriers. So tell me any barriers that you experience, and I know you may have had one or two. So share some barriers with me.
A lot of barriers. I would say, as far as I'm gonna say my family, I gotta be truthful. They're a little bit of barrier with me in the school. They was like, "You doing too much. You're gonna help all these people. you spending all this money out your pocket. It's going to stress you out. It's going to burn you out. You're working, you're doing all this stuff. But truly, help my students, it brings me so much joy. So it's some kind of, it's like I don't drink or smoke or do anything, but that's my high, that
Yeah.
high. And I can't explain that enough to people. Like, this is what feeds me, so I need to continue to do this because this is the work I was called to do. So I would say my family is a barrier, and that's just trying to be protective of me, and I understand that. But they're a little bit of a
Yeah.
barrier for me because they don't like me doing all this stuff, and I'm always out in the community advocating for my students and stuff. So I would say
Well,
that.
and that's like a calling. That's that calling that you can't help it. It's like you wake up in the morning to touch lives like that. So I totally relate to what you're saying. Any other barriers?
Say there's burnout. I think when I was working on a floor more, I don't go in as much now. Now I'm just like emergency nurse PRN, but they call me this emergency. Just being short staffed and overwhelmed sometimes, because as a senior nurse, I have a lot of experience. They'll give you the heavier patients, right? The more sick patients. So I think it was kind of a barrier for me to kind of not want to be at the bedside full time anymore. Just felt like it's always give me all the heavy patients. Like, it's a lot of stress on your mind when you have all the critical patients, all the time. So I would say that's a little bit of a barrier for me. I can't think of another one.
Yeah, I'm just wondering, did you have any like internal struggles or you were just ready to do the thing?
Was ready to do it. I think internally,
Because some people they're like, oh, I don't think I'm, enough to do this, or I'm afraid, or whatever. But it sounds like you were like, no, this is my calling.
I
This
knew
is
that's
what I'm
what I
going to
wanted
do.
to do. Yeah. I think I was worried
Yeah.
about technological part with learning tech and AI and stuff, because I didn't come from a tech background. I was very lucky at the time when I also this transition. I was working at Kaiser and I worked on their they implemented out a new AI program. I didn't even know it was AI at the time, but it's called Compass Rose, and a lot of people were struggling with it. And they was like, Nina, can you figure this out? My boss came to me and I said, sure, I'll go home and play with it. And I figured it out, over a weekend. And I came back and I started teaching people about it. And then I learned more later that it was AI and all this other stuff. So I think that made me feel more comfortable. But I think that was maybe a barrier for me, I guess, just not feeling confident in myself and in my
Yeah.
skills, and feeling old and coming into this new age, learning all these tools and stuff like that. But now that I'm in it, it's not
Well,
that hard.
that is wonderful. So tell me about why smart nursing? Why did you decide to write this book?
I had to write that because I feel like as I learned more about AI and start to put the pieces together, with Epic and Cerner and Compass Rose and all that, a lot of this, and going to some of the conventions and stuff. I go to a lot of the AI and healthcare conventions, the voice for nurses also, because there's no nurses out there. I think I'm sometimes the only one. We need to get to
Oh,
the table when these decisions are being made. Yeah, and join in the conversation.
yes.
I decided to write that book because I was talking to a lot of my colleagues about AI, and I told them, I think this is something that we need to be more involved in as nurses, because a lot of decisions being made about AI, and they're implementing it every day into healthcare. And a lot of nurses don't even know. They don't know it's in there. They don't know it's embedded in the system. They're scared of it. And it's like, it's not really for us to be scared of. It's just a tool. Wrote the book to kind of explain that process, that AI is not here to replace us. It can't replace us. It can't, it can't give baths. It can't give showers. It can't hang blood.
Right.
It's just a tool, just like our stethoscope. So kind of softly kind of lay that layer, and also awareness to some of those programs that they're using that they don't know that's AI. So I wanted to add that into
Yeah.
it. And I think I talk a little bit about kind of what I do with AI. Yeah.
Yeah. That's good because I like that you're at the cutting edge or at the beginning and why you're provoking us to learn more about it because I think if we don't, then you'll have responses that are like robotic. I think if your voice is in the beginning of AI, then you can infuse a compassionate response in there versus just a computerized response. So that's why I see the value of being a part of the solution with AI and the cutting edge, like you, like writing this book. I started reading it and it's really good. I was like, wow, this is really great, especially for those ones that are like, oh, AI is like, it needs to go somewhere. It's not going anywhere.
It's not going
It's
anywhere.
just like,
Embedded
yeah,
almost
it is our new
everywhere.
world.
Yes, and I
Yeah,
think nurses need to jump on it. At least if you just know a little bit about it, help you keep your job, I think too. So because the table, I'm at these conversations and it's changing already. So that's another reason why I developed that program to just try to get people involved in some basic knowledge. That's all you really need. That's all you really need. Just a little bit of basic skills. But the biggest issue I have with AI, I'll just say this, is that it's really biased. So because we have, and this is another motivation why I want nurses to get involved, is because with our healthcare system, with our data that they're collecting, is very biased. It's not a healthcare professional that's involved in this implementation. So they're not a recent study that's in the new book that'll come out about, patients that they rolled out with different drugs with diabetes. They don't take in everybody in the community is not involved in this information. So when they diagnose these patients based off AI, very biased. But
yeah,
nobody's taking that into consideration, I think, right now. So I think that's a big
yeah, and
deal.
that's
And
critical.
yeah,
Yeah,
people.
because I'm thinking about all the social determinants and all of the, stuff that we deal with. Somebody has to be able to put that to the voice. So man, so how do you see that then, Nina? So what was the question I guess I'll ask is, what do you see for the future for AI in nursing in like the next 5 years?
Going to be huge. I think facilities are going to require nurses to have some kind of background in AI. Think in all levels of care too, med surge everywhere because, like I said, they're implementing it every day. I was at a recent convention and they're doing some pretty cool things with it. A little bit biased in the system that they're using it, but they're kind of eliminating a repetitive task that they would do, like let's recheck this list, let's recheck this, and categorizing people who's going to be seen first, as far as priority. Just like when they come into the ER now, a lot of that going to be seen first is going to be determined by what the AI, what they determine who's more severity. It's not the nurse looking at the patient anymore and saying, "Oh, this patient looked like they having real chest pain. Let's see this patient first." So the whole system
Wow.
is going to change. Yeah. And there's robots that's being implemented. There's a lot of AI detection going on that's being already integrated in the system, to where when patients walking in, they're kind of already analyzing your health. They know your vital signs. They know if you have, any brain tumors, which is, some of it's going to be really good. Some of it is going to be good, but if it's misdetecting things, then stuff can get missed
Yeah.
too. So
Well, yeah, and that's what I'm thinking when you said that they're triaging because it's like nothing like putting your eyes on someone and
it's
seeing
different. Yeah.
what's going on. It's totally different than you just capturing data. And so that's going to be very interesting. So I understand why it's so important now
Yeah, it's
for us to
important for
be
nurses to
involved
get to
in
the
it.
table. Yes, because the people that are creating this, the AI is all about who's training it and what you're feeding it, right? If you're feeding it the
Yes.
right data, and if you're the right trainer with experience in these areas, it'll work better. It'll be more effective. It's going to give you a better output. But if you're somebody who's just, I don't want to shame IT, but if you're just, somebody in IT and you just inputting data, is not going to be as effective as it should be.
Yeah. So what would you say to the nurses out here that listen to this podcast? Like where could they start as far as learning about besides getting your book? Because I think you should get her book because it is very foundational and really great stuff in here so far that I've read. So where would one start?
Say start looking into different summits. Go get educated on some of the information sessions that they have. They have actually a lot of AI healthcare summits all around. I'm here in California. There's a lot of always in California. If you guys are interested, join my certified AI nurse consultant program, where I teach a lot about AI. I'll be teaching now my new location in Atomas. I'll be teaching some regular classes on a normal basis too, just about AI, just basic chat GPT, so you can get an idea of what that is and how it needs to be safe and how you need to change the settings on it so when you are putting your information in there that it is safe, so I would just say things like that. Look for different classes. I've seen too many far as nursing, created a lot though, and I will be offering it to the general public and going out to different facilities to offer it as CEs because I'm a continuing education provider too in California. Do that too. But I would
Okay,
just,
that's
and then,
awesome.
yeah, I know Stanford has a pretty cool AI program too, but it's more geared towards providers, necessarily towards nurses, but that's okay too, just to get in some entry level. LinkedIn has some cool AI courses too that I saw too. They have some good ones too. Yeah, just like Google something and just get familiar. YouTube is great. There's a guy named Timmy who I talked to. He's also heavy into AI too, and he's an informatics, a nurse, and he has some really good information also on YouTube.
Well, that is wonderful. I'm so glad that you're doing this. So, if you can give us a list of what you're doing and your information, I'd love to put that in the description. But if there's someone out there that want your services, can you let us know what you do and how people can get in touch with you?
Sure. So my program is helping healthcare providers or CNAs become an LVN. So I do that program. Most of it is online, and I have an instructor that's also online and one in person that kind of helps them. I'm kind of overseeing the program, just making sure that they're staying compliant. I also do continuing education courses where I'm giving CEs for nurses to keep their license. I do CNAs, LVNs, and RNs. I run that AI nurse consultant program. We do that every 3 months. We run that and it's online. And I actually joined in with a program, AI Innovision, with Alicia Little, with her also AI consulting program. So they get all the I think it's really good. They get all the nursing, healthcare programs and courses that I have, and it's a continuous learning basis. And they get all the generalized thing on AI. So if you don't know anything about AI, you can start from the basics, and it's continuous learning. Every time a new AI tool comes out or something new comes out, we do a whole breakdown of it. We create curriculum for it, and we do a course on it to let everybody know what it is and how to use it safely in the right way.
Okay, no, that sounds really great. So, when people are on the podcast, I'd love to find out like some wisdom gems because I tell you, you have a lot of wisdom and you have shared quite a bit.
Yeah.
So, what are a lot of people that listen? They're kind of sometimes stuck. They may be burned out, or they are looking to do something like you started the school, just like follow their dreams. And so, what would you say to those people, like three wisdom gems? If I said, what's Nina's top three, what would you say to that?
Say follow your spirit. Whatever your spirit is telling you to do, if it's heavy on your heart, I would say follow that. Like for me, the heaviest thing was becoming a nurse. I'm glad I followed that through and got through that because I hear stories from people who they want to do that and they just never did it, and it tears you up inside. So follow your spirit. If your spirit is guiding you and pushing you, and something's it's on your mind every day. You just need to do it. So create a plan, support team that you need, and follow through and get it done. And as a nursepreneur, it's
Yes.
amazing to be a nursepreneur. I'm so glad that I jumped out on faith and I did it because my life has changed, and I love being a nurse and I love taking care of people, of course. But I think being a nursepreneur really has highlighted my life, and I just feel like I'm serving even more than I was before. So it's definitely a good feeling, and people really need your expertise in the community. You'd be amazed you have to offer based on your experience as a nurse. It's truly valuable.
That's awesome. Yeah, that is so awesome. I love that. So, a nursepreneur, were there any barriers to you becoming a nursepreneur? I want to go there again because what if somebody's there? I tell you what, this is what you can do, Nina. If there's someone listening right now, they are in the valley of decision and they are like, I have this business, I have this dream idea, but I don't know how to execute it. Like, what would you say to that person?
They do it. It's the best decision ever. I think I guess I'll go back. One of the biggest barriers I had when I first started when I got the first location was I was worried about finances. Can I afford to take care of help these students? Can I afford to pay for this building? Can I afford all these things? And you will find a way. You'll find a way. So I think finances is an issue. Just have faith, call your friends. People usually will help
Yeah.
you, finance your dream, especially if it's something you've been talking about. They will want to help you. But I say do it. Another thing I did struggle with, now that I think about it, was cutting my hours at my job. Because I used to work 40 hours. I feel like I had a really easy job because I work from home. I'm not going to the hospital, but I had to struggle with that. Well, do I leave this hour nice position just to follow my dreams? And I may not make any money because, like I said, I'm sponsoring these students. I may not make a
Right.
dime. So that was a hard decision for me, and it was a struggle at first, but everything just started to fall into place, and now it's just been beautiful. So I would say it might be a struggle, but if it's something you really want to do, and especially if you're burnt out, it's just time to make a change. It's just time to make a change.
Exactly.
It's definitely time. But nursepreneurs are definitely wanted. They're highly needed. Do want your expertise, and there's so many things that you can do with your experience. It's truly endless. I was actually blessed with an opportunity to a course for an international education platform. So it's really good, and they gave me a 4-year contract with a renewal every year of more money. So so it's an
That's wonderful.
experience. So you just never know what
Yes.
opportunity is going to come your way. But if you out last thing I would say is working the 40 hours. I didn't have time to really do the business like I wanted to. So once I gave the 40 hours up and I went per diem, I really had time to focus in on my business. That's when everything kind of started coming together.
Well, that is wonderful. And that's great advice too, because I definitely heeded to some of that when, it was time for me to make the shift into business. So, it has been such a delight to have you on the show. Yeah, it was such a delight. I'm so excited to finish this book and to stay connected with you to see what's going on. But just talking to you made me want to know a little bit more about AI and how we can impact AI. So thank you for what you're doing. Thank you for raising up more nurses in the world because we know we need them. So we need more people like you. I hope somebody hearing this would even be open to donating to your nonprofit so that you can yeah, we need people to help so that you can continue doing the things that you're doing because that's amazing. Do you know how many students have graduated from your program?
103 total out of the 10 years that I've been doing this. Yeah. And I have
Wow,
27 now that are
amazing.
set to be done by the end of the year. Yeah.
That is so amazing. I applaud you big time. So thank you so much for being on the show. I'll put her details in the description and you guys have a nice day. Hey, thank you so much for listening. Hey, I want to invite you to join my Substack community. I actually have a free newsletter that I send you every month when you join. There's also another level to it. If you're a paid subscriber, you actually get a copy of my book, When the Moment Chooses You, and signed by me, as well as the access to a Q&A segment that we do and other live shows that I'll be doing. I'm also going to be doing a special Awaken Align class for those who want to really pursue their destiny and seize those moments that are in their life. So join that community. I'm trying to move things over there so I can have more contact with people. So I'll see you over there. I'll put the link down to join. And basically, it's only like $10 a month and $8 a month if you do the yearly subscription. So I look forward to seeing you over in that community. Thank you, and I love and appreciate all of you. Bye bye.